I'm Dr. Jonathan Solomon. I am a cornea refractive surgeon in the Washington, D.C. area at Solomon Eye Physicians and Surgeons. So in my career, I have performed PKP, I've performed DALK, I have performed partial transplants in the form of DSEC, DLEC, and DMEC. I have performed corneal transplants of all kinds. And there is a place for transplants to this day for individuals who are in need. But in truth, I still believe it is in our best interest and in the patient's best interest to avoid transplants when possible, or a better way of saying this would be to preserve the patient's tissue when possible. So I first learned about KeraNatural over the course of the past 10 years, really through the literature and communicating also with colleagues at meetings, and had been watching it from afar. It had been started really outside of the U.S. When it was brought to my attention that this was something that could be performed here, I jumped at the chance. Improving geometry with tissue addition without subtracting their tissue, which is a lifelong subtraction, is so valuable, and that's what KeraNatural brings that we didn't have prior. The clinical or scientific factors that influenced my decision making to adopt CAIRS were really in an effort to reduce the relative risk that came with the existing treatment paradigm with intrastromal rings. Although the risk factors were very low, it really fell on the considerations of ring extrusion. Extrusion was real. I had seen and had managed cases of extrusion, and when you are implanting donor tissue, extrusion wasn't an issue, and I liked that idea. If there was the potential of incorporating stromal tissue from a donor, that potential then was brought to a risk factor of 0, and so that opportunity intrigued me. The onboarding process for KeraNatural was very similar for the onboarding process as it is for any technology, and that is you want to make sure that the variables are limited. You want to have the same technology, the same tools that you have in place. We were able to understand, for example, that the tissue could be dehydrated ahead of time. We were able to understand through way of videos and instrumentation that was supplied to us. And those two bits of information and communication with our colleagues provided us with enough information and enough understanding, and not to mention our baseline understanding of intrastromal rings allowed for a very steep learning curve. If this is your first foray into intrastromal ring segment placement, there is some nuance to it. And so be patient with yourself and with the process. However, I do believe it is a process that is worth exploring. Certainly if you are a cornea surgeon and you are looking at placing a CAIRS or a KeraNatural as an alternative to a DALK or a PKP, without question, as an alternative, a KeraNatural is a much better option if you have this as an alternative. When it came to picking our first patients for KeraNatural, we looked for individuals who showed relative stability. So typically individuals 35 or older. It was a relative safe bet, who had inferior cones, who were looking for geometric improvement. They didn't necessarily have to have cross-linking performed, but we were looking for individuals for geometric improvement. So managing expectations with any surgical procedure or engagement with the patient is actually at the heart of medicine to begin with. At the outset, we probably should say this is not LASIK vision correction. This is not a procedure where someone is expected to come out 2020 or 2015 or 2010 with no glasses. And that very well may need to be said at the beginning, certainly at a consultation. Oftentimes patients can come in and they may say, hey, look, I've been told that the right treatment for me is cross-linking. Or they may come in and say, well, I understand the only thing I can do is a transplant. And in large part, what we find is it's best to meet a patient where they are. And in many regards, it is rather refreshing for you to say to them, hey, look, we have this treatment that allows you to keep your cornea. It allows you to see better. We will be able to reshape your cornea with a small laser-delivered opening to your cornea and reshape without having to take your cornea or to provide light to it that allows or creates this rigid shape without reshaping it. And so in every way, CAIRS offers oftentimes the best of both worlds. And it offers flexibility. We're not taking a cornea and we're not stiffening it that then makes it more difficult to then reshape it. And so CAIRS is a wonderful tool that allows a great deal of flexibility. And patients love that opportunity. And that's what's so unique and so wonderful about KeraNatural.